So greetings to everyone. I'm Sachi Ojha from Lucknow Medical College from India, and today I will be talking about the perception and the feedback of undergraduate medical students on medical humanities. I would also like to congratulate all my fellow presenters for such great presentations. Moving on, medicine is an art as well as a science. By art, in the sense we mean a range of skills and insights that the doctors bring to the practice of medicine. Literature, arts, economics, sociology, and history can be used to broaden the vision and understanding of medical students. Art has been used in medical education in the West to enhance the visual diagnostic skills of medical students. Problems with using paintings, photographs, visual aids, and the role of paintings in the future studies has not been previously done. There is a great need of a humane doctor with the understanding, assisted by interpretative ability and insight, to apply this scientific evidence and skills to the individual patient. The lack of empathetic attitude towards the patient is one of the important problems identified by the certifying bodies. According to the American Society for Bioethics and Humanities, the American Association of Medical Colleges has identified the development and enhancement of empathy in medical students as a key goal. In recognition of this importance, many universities and medical colleges have awakened to the need of teaching empathy to medical students. The present study was carried out to understand the empathy and its importance in medical care, to appreciate the patient's perspective of sickness and health, to know the effect of disease and sickness of a loved one on the family, to be aware of the doctor-patient relationship and recent developments in this vital area, and to be familiar with what it means to be sick. The present study was carried out for the 6th semester medical students of Lucknow Medical College. Photographs and paintings were of artists obtained from literature, arts, and medicine database. The activities undertaken by the students were: what do you see, what do you feel, and appropriate feedback for the activity was taken. The previous studies done in this respect have shown that there is a great need of a humane doctor. Empathy describes the ability of a doctor to visualize and understand the patient's suffering and pain. Many medical schools offer a number of elective medical humanity courses, and students can select a particular one of their interest. So the paintings and the visuals that we showed the respondents were, the first one was a painting from 1632, the anatomy lesson of Dr. Nicholas Tulp. If I were to ask many of you, you would have different perceptions regarding this painting. The background of this painting is that this Dr. Nicholas Tulp is explaining the musculature of the arm to the medical professionals, and some of the spectators, who are various doctors, had to be paid commissions to be included in the painting. This is a post-earthquake visual of Kathmandu of 2014, where immediate medical services are being extended. This is a painting of 1820 of Goa with Dr. Raraita. Goa may have expected to die, but she was nursed back to health and lived another 8 years under the care of Dr. Raraita. And the background, which many students thought were ghosts, are perhaps his servants and the priest, who seem to be the portents of doom. This is a painting of a dead mother and the child. The dead mother transparently lies on the bed, while her young daughter, who is probably just entering sexual maturity, which is suggested by her red dress, stands beside in apparent disbelief, as there is no mother left to guide her. This is a patient in the ICU who is almost departing. Now this is a picture of a fire at a hospital in South Kolkata. The next is a 6-foot-high hug. The clasping patient and the caregiver are divided here by the ivy rod that sunders the couple like a dagger in the artist's word. And this is a painting of the paralytic and his family, and it has been described as the morality in pain, and it has championed the new aesthetic principles by which art should play an educational role and an enlightening role. So the results are that 58 students participated, of which 18 were male and 40 were females. We asked the students to whether they enjoyed the use of the paintings in the sessions. So 46.55% gave positive responses and 39% and gave positive ratings to the use of the paintings in the modules, which we showed on a Likert scale. Now, the paintings with which the students identified the most, the first being the patient in the ICU, with which 70% of the students identified, the fear of losing all. And the second one is the anatomy lesson, which takes us all back to the first year, and 67% of the students identified with this painting, reason being it was eye-catching, the dark nature of the painting, and the pain of the patient. And 55% of the students identified with the earthquake and the first aid, reason being that they said that preparedness is required, and 50% of the students identified with the mother in the child painting, saying that the child is not ready to clear the loss of the mother. Now, the respondents' perception about the activity, and they were asked to create a story of 50 words and a feeling of usefulness. So according to 67%, it was perceived to be useful, and the reasons being that it was analyzing humanity, it helps in creatively exploring one's talents, it improves thinking and imagination, it heightens emotion, it is a nice way to express feelings, it is an interesting way of learning, and it arouses professionalism. According to 15%, it was not useful, and 17% chose to not respond. So the advantages of learning using painting for medical students, 23 students thought that it promotes empathy and feelings, 17 thought it was a creative and an enjoyable activity, 10 thought it increases thinking capacity, 7 thought it provides opportunity to share ideas with groups, it sensitizes students to future scenarios, and underlines the importance of doctor-patient relationship. 6 thought it improves the power of imagination, it is a refreshing break from theory classes, which is really necessary, and 5 thought it promotes lateral thinking. The median total scores of specific parameters according to the gender of respondents was taken. The parameters were enjoyment of the paintings, usefulness of annotations, and the usefulness of paintings. So the most common overall comments about the use of the paintings were, 18 respondents said, I could feel what I saw. 18 said, I enjoyed the sessions, and 12 said some paintings were hard to interpret. Suggestions to make annotations about the paintings more useful were to make them shorter and more precise. However, 36% had difficulty with the exercise, what do you feel? In conclusion, participant response was positive, and they were satisfied with the use of photographs and paintings in the study. Use of more paintings from Asia and India can be considered, and further larger group and longitudinal follow-up studies may be required to understand whether the use of photographs and paintings succeeded in fulfilling the objectives. I would also like to say a doctor needs to be socially sensitive and ethically correct. Individual and competitive contemporary history can help the students understand our socio-economic realities, and they can better relate to the patients and their problems. Thank you.